Before you walk into a room, what do you always want to do?
Wash your hands.
You're always going to wash your hands, and and also what is another thing you might want to do? What was that, Richard?
Read the patient.
Read the
Read the
patient.
patient, but also you want to make sure you read their file, right? You look at their information. What could this patient have? What's the condition? Obviously, if there's an isolation card outside or something that you're going to be wearing your PPEs, there's a reason why, right? So you want to make sure you always check their, the file or their information chart and know what's going on. Another thing that you might notice on the doors or possibly next to the doors is it's an actual sign that'll let you know whether it's biohazard or is it airborne or is it just, what type of isolation is this patient on. And of course, each hospital or each facility will actually let you know which one it is, so that way you know how to prepare yourself or what to put on, okay? So you're already gonna identify yourself, knock at the door. Hello, my name is Israel. Hello, Mr. Jones, how you doing? My name is Israel. I'm gonna be doing XYZ, and before you enter, actually, you wanna make sure you start with your PPE. And the PPE is one thing that I always try to remember is always start from head to toe. So outside, you'll have a card or anything that has all your PPE materials or equipment. I start with, covering my head, either be a bouffant hat or, surgeon's cap, whatever you may have. I put in my goggles, and of course, you're gonna, wear your mask. So at this point, I'm just gonna demonstrate and just put my mask. So now that I have the mask on, I want to make sure I want to put shoe covers. So we started with the head covering, the mask, goggles. If you don't have goggles, sometimes they provide you with the mask with a shield. You want to make sure you have that on. Put your shoe covers on, and the last thing you're going to put on is actually your isolation gown. And I just get this out, shake it off. For the purpose of not tearing this gown, I'm just gonna make small, just tie this very loosely so it doesn't tear. So I suggest you guys do the same thing. Just one loop should be okay. And then this, just wrap it around. Those of us bigger guys like Jay, just go easy on this, don't tear it off. And the last thing I want to put on is also my gloves, right? This will usually go over the cuff of the gown because we want to protect ourselves from anything, right? We don't want to expose any part of our skin with the patient or possible contamination. Okay, so now if you have your PPE equipment, you're ready to go in and actually assess the patient, or do whatever you need to do. So again, we're going to talk about head covering, goggles or a mask with the shield, mask, shoe covers, your gown, and your gloves. All right? So once we have all that on and you already took care of the patient, now it's time to remove everything. So the way to remove everything, I'm just going to show you guys. Normally you would tear this off, but for the purpose of saving the gown, we're just going to do this. What you want to do, you want to kind of grab on from here and just pull away. Almost peel the gown off away from you. Rolling it. Notice how my sleeves are still inside out. I want to keep rolling. This will go out into the garbage. I still want to keep my gloves on because I want to make sure that I still got to remove my shoe covers. If I remove my gloves and I go and touch my shoe covers may have any kind of secretion, fluid, body fluids, blood, or anything. So I like to keep my gloves on. Remove my shoe covers. That goes also into the garbage can. And before I walk out, then last thing I'll remove is my gloves. We talked about it earlier in the previous video. So it goes into the garbage. One last thing I want to do before I walk out is what? Wash my hands again. I'm going to wash my hands again thoroughly. Thank you, Mr. Jones. We'll see you again in about 2 hours or whatever. And leave the room. Once I exit the room, this is when I actually then, because I have clean hands, I can remove my mask, my head cover, and my goggles, or whatever else you have on. So that concludes how you would walk in and put on your PPE and how you would remove it. Any questions?
So for that, oh, sorry.
Yes, go ahead.
Do you still do like the sterile glove technique, or is this like a more, or does it just depend on the situation?
It's gonna depend on the situation. If it calls for an invasive procedure, of course you were gonna wear your sterile gloves.
Right, and you put them on as.
Exactly, you
okay.
put them on the way we discussed in the previous video. But if it's just something you're going in, and again, it's gonna be on the door, it's gonna post it, it's gonna tell you what kind of isolation the patient is gonna be on.
Right.
It will determine your kind of PPE that you're gonna go in and wear, okay?
Okay.
Eddie, I know you had another question?
Oh, so you always put your PPE outside the room and then you take it off inside?
Yes, that is a very good question. You wanna just put it outside because you don't wanna walk in and start putting all this stuff, cause if it's someone that has airborne, and I'm wearing the, one of the duckbills, N95, so obviously this patient has some kind of airborne bacteria or airborne pathogen that if I go in there without this on, I'm gonna breathe this in, and I'm now gonna contaminate myself. So to answer the question, yes, you wanna put it before you're into the room, and before you leave the room, you don't wanna walk outside and not carry anything outside into a clean, sterile area or an area that's, we're trying to isolate the patient from, okay? Any other question? Get a message.
So, I'm gonna add a couple of things, because he had an N95 mask. Generally, there's what they call an ante-room, so there's a room before the room.
Yes.
So you put your mask on, you do all your stuff, and then, you're wearing the gown to prevent any kind of like droplet stuff, right, and protect your clothing. So you'll wanna remove that, you'll leave, but you need to keep the mask on if it's airborne, okay? So, because again, you're still in that negative pressure room, you need to be out in the ante-room before you can take off the mask. Does that make sense to everybody? So that's why he left the room and then took off the mask. But, if you had come into anything, if you're concerned about that, then generally what we would do would be to put on maybe a clean pair of gloves before you take the mask off, if there anything got on the mask, okay? So what we told the other group was to just use this clean pair of gloves to take off the mask like this. Okay, some people, if you're gonna grab from around and pull the straps off, then you would wanna have your clean hands and like pull it off like that, cause you don't wanna be wearing the same gloves and then pulling on the straps. Does that make sense? Cause you have like soiled gloves that you're not gonna now touch your hair. So just if you're concerned about it, then put on a clean pair of gloves and then just grab it and toss it, the mask. But that's why with N95, there's a room before the room, and they call that the ante-room, and generally the ante-room is where you usually gown up, and that walk in, do your thing, take it all off, but the mask stays on until you're back in the ante-room with the airborne precautions.